Rheum pathology, Raynauds phenomenon, and scleroderma. This is the last part for Rheum. So kind of key takeaways. First off, let's start off with Raynauds phenomenon. Raynauds is just a decrease in blood flow to the skin, usually affecting like our small vessels. It's secondary to arterial vasospasm, and it's usually in response to cold or stressful situations, okay? It's going to affect those, probably your extremities the most, okay, and your digits, specifically your fingers. And so what they want you to know is that they first originally change white, then it goes to blue, and then you get reperfusion, changing them back to red. Okay, so those are the color changes associated with Raynauds phenomenon. Now, what they want you to know is, first off, how do you treat it? You have non-dyes and you have dye, so DHPs and non-DHPs for calcium channel blockers. You're going to give them the dye calcium channel blockers, okay? That's going to be helpful in treating Raynauds phenomenon. That's a question that they might specifically ask you. Now, they want you also to know that Raynauds phenomenon is highly associated with our scleroderma, specifically Crest syndrome, okay? And so now this is a perfect segue into scleroderma. So scleroderma usually... So what it is just a systemic sclerosis, okay? And what the patient's normally the initial symptom that they present with is Raynauds phenomenon, okay? Now, what they want you to know essentially for this patient, for scleroderma patients, is kind of just like the presentation overall, because the presentation is just going to really be helpful in you deciding whether they have scleroderma. It's usually going to be more of like a diagnostic question than anything else. But let's just walk through it real quick. So the first thing is that it's a triad of autoimmunity, non-inflammatory vasculopathy, and collagen deposition with fibrosis. The collagen deposition with fibrosis is probably the key features that you're going to see with symptoms relating to scleroderma, okay? So you're going to see sclerosis of the skin, which is like puffy, taut skin without wrinkles. That's something that they love to say for scleroderma. If you see that in a patient in the stem without wrinkles or taut skin, puffy skin, they're talking about scleroderma. You can see fingertip pitting. There's a photo of the fingertip pitting and what it looks like. That's also associated with scleroderma. It can involve systems like the kidneys, which can lead to scleroderma renal crisis, and you're going to treat that with ACE inhibitors. It can cause pulmonary issues like interstitial fibrosis, which is very, very high yield, okay? Because that's the main cause of death is going to be pulmonary diseases, specifically interstitial fibrosis. It could lead to GI issues, which leads to decrease in peristalsis and lower esophageal tone. Lower esophageal sphincter tone is going to be decreased as well. So you could get dysphagia and heartburn because of this. It could cause cardiovascular abnormalities or anomalies, okay? So keep all of this in mind. Scleroderma is a systemic issue, okay? Systemic sclerosis, okay? So it could cause also small intestine bacterial overgrowth. That's something that they like to ask about. Now, the key takeaway point here is what is the key kind of cells involved? The first key cell involved is going to be fibroblast, because remember, it's collagen deposition with fibrosis is what's going to usually cause our symptoms. So fibroblasts are essential to the pathophysiology of scleroderma. Other essential cell types are endothelial cells and T lymphocytes. So keep that in mind as you're doing scleroderma questions. There's two separate types. You have diffuse scleroderma and limited scleroderma. Diffuse scleroderma is just widespread skin involvement, okay? So it only involves the skin, and it's going to be associated with anti-SCL70 antibody, which is anti-DNA topoisomerase 1 antibody, and anti-RNA polymerase 3. That's all you really need to know about diffuse scleroderma is those two antibodies. Limited scleroderma is the higher yield one that you have to know. It has limited skin involvement. It's confined to the fingers and the face, okay? And it's associated with Crest syndrome, and Crest syndrome is very, very key, okay? So, first off, for Crest syndrome, it stands for CREST. First, the C's are calcinosis cutis, which you could take a look at it. It's on the fingertips. You're going to see essentially calcium deposits near the skin of the fingertips. It's also associated with anti-centromere antibody. Anti-centromere antibody is way more important than the other antibodies in diffuse scleroderma. If you were to remember any antibody for scleroderma, it's going to be anti-centromere antibody. I don't even remember getting any other questions besides anti-centromere antibody for scleroderma. So that is the high-yield antibody you should know. Next is R, which is Raynauds phenomenon, as we discussed, is usually the initial presenting symptom. E is esophageal dysmotility. We discussed that back in the GI symptom. But remember that esophageal dysmotilities can be seen in scleroderma due to fibrous replacement of the muscularis, okay, of the muscularis layer in the lower esophagus. That's what causes the esophageal dysmotility in scleroderma. It's due to the fibrous displacement of the muscularis layer in the lower esophagus. You're going to see S for sclerodactyly and T for telangiectasias, okay? So those are very important. Calcinosis cutis with anti-centromere, Raynauds phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasias. That makes up our Crest syndrome, okay? So overall, it's going to be scleroderma is a widespread fibrosis and collagen deposition. That's what it is, with expansion of dermal layers. Okay, so that's why endothelial cells, T lymphocytes, and fibroblasts are the key players here. You could see pulmonary complications, which are the most common interstitial fibrosis. It's the main cause of death, and it's the most common symptom. It can present with Raynauds phenomenon, and it has multi-systems associated with it. Crest syndrome is the highest yield thing you should take away. Okay, so that's it for scleroderma. If you have any questions, please reach out.